Okay, the topic of this next story is a rare but potentially deadly illness. It's often linked to improperly canned foods. And this week, the scare of botulism prompted a baby formula producer to recall all of its products nationwide. But what exactly is botulism and how can you protect your baby? Public health educator Dr. Griggs is here this morning with all of the answers. This story really escalated from a recall of some products in a few states to now a nationwide recall of all of the products here. So this is something we need to be paying attention to.
Yeah, so as of right now, we have 23 infants that have been affected with botulism in 13 states. None have died, but they are in the hospital. This is a very serious thing. It's called Byheart is the name of the formula, and it represents less than 1% of all formula used, but it's very serious.
We know that so many babies have the very specific formulas that they like or that they need to have. So parents should be checking their pantries right now. If you have this or any of the Byheart products, you need to throw them out and explain to us why that is, Doc.
So it comes from a bacteria called Clostridium botulinum.
quite a mouthful.
It's quite the word, and it's actually one of the most, the toxin is one of the most powerful toxins on the planet. It can cause nerve paralysis. In infants, it shows up as constipation, difficulty feeding or sucking, weak cries, and can progress to respiratory failure because it can lead to nerve paralysis if not caught early and treated.
Let's run through those symptoms again, because I remember kind of reading about this in the week and kind of reading some symptoms, and I saw one to be slurred speech. And I came to understand that was an adult symptom of botulism, but we have this added danger, this added, obstacle to overcome here, because infants can't exactly communicate when they don't feel well or something's going wrong. So run those symptoms through again.
So it's called infant botulism, and it was weak constipation, a weak cry, difficulty swallowing, a floppy or loose limbs, because it can cause nerve paralysis. And again, it can progress to respiratory distress or respiratory failure if not identified and treated quickly.
So botulism being a very rare case to deal with here, but very widespread in this formula recall. This seems like a better safe than sorry type of pull everything from the shelves.
It very much is, because they want to make sure it's not something that is a process issue. Infants don't have the gut bacteria that's mature enough to fight off the Clostridium bacteria. So it's pasteurized, they're clean, there are processes to make sure that things are safe for them to take in. So if something like this happens and it's this widespread across 13 states, it's better safe than sorry.
Now, we've learned that the cases have jumped up, but no deaths have been reported. So if the baby becomes infected and you get them to the hospital, what happens then? What
happens is they'll do an assessment, they'll do respiratory support, and then gives things to support the child and then help treat the bacteria.
So this could be a long haul type of hospitalization for these parents.
It could be, especially if the respiratory failure is involved. It could involve an intensive care unit admission. It depends. It can really progress. So it's something to identify quickly and get treated as soon as possible.
Alrighty, can we throw up that video one more time of what you need to be checking your pantries for? Give it a minute here. It will cycle through the exact formula that is being recalled here. It's called Byheart. Like Dr. Griggs mentioned, a smaller subsection of the larger formula industry here, but we know that babies have their particular preferences here. So Byheart, B-Y-H-E-A-R-T. There it is.
And right now it's not expanded to any other brand. It's just the Byheart brand. So you want to stop it, throw it out, switch to something else, but notify your doctor immediately.
Absolutely. Thank you, Dr. Griggs, for all of the health tips and keeping us safe, our family safe. We